Hi, my name is Christy Bricker, and today we're going to be doing the neurological assessment for the physical examination health assessment course at Rowan University. Can you please state your name and if you give consent to be in this video?
My name is Summer Perry, and I give consent to be in this video.
Thank you. We're going to start with some subjective data. So first I want to just get a brief history on you. Do you have any history of frequent headaches or severe headaches?
No.
All right, good. And any history of a head injury?
No.
How about seizure disorder?
No.
Do you experience any dizziness or vertigo regularly?
No.
And do you notice any tremors in your hands or face?
No.
Do you have any weakness, numbness, or tingling in any of your extremities?
No.
And how about when you speak or swallow? Any difficulty there?
No.
Okay, so we're going to go on with the physical examination part, the objective data. So we're going to start with her cranial nerve examination. And we'll start with cranial nerve 1, which is her olfactory nerves, and that's going to detect her sense of smell. So the best way I can do that for the purpose of this video is going to be for you to close your eyes and include one nostril at a time, and then I want you to just tell me what you smell when I hold something under your nose, okay?
Okay.
All right, so just close your eyes and hold one side, and tell me what smell that is.
Cinnamon.
Yes. Keep your eyes closed and include the other side, and tell me what smell that is.
Coffee.
Correct. All right, so that's cranial nerve 1. Next, we'll do cranial nerve 2, which is the optic nerve. The best way to assess the optic nerve is with a fundoscope to check her optic disc, which I don't have. If I had one, I would be looking in to assess her optic disc. So next we'll move to cranial nerve 3. 3, 4, and 6. And so 3 is going to, 2 and 3 are both used to assess her her pupils to see if they're reactive to light. And so we're going to shine the light and do the direct and consensual light reflex test. So I want you to stare straight ahead. I'm just going to shine this light in your eyes, and I'm going to check to see if her pupils contract and dilate. And it does. And do both sides. Good. And for consensual test, I'm going to shine in this eye, and this pupil contracts over here, shine it here, and this pupil contracts as well. So those nerves are intact. Next we'll do, which uses 3, 4, and 6. We're going to check her extraocular eye movement. So we'll do the cardinal signs to assess them. So I want you to follow my pen with your eyes, okay? Good. Good. Perfect. Okay. We'll jump to cranial nerve 5 now, which is trigeminal. We're going to assess the motor function in her face. So I want you to clench your teeth real hard. All right, good. And I can feel that her jaw is tightening. And then I want you to move your jaw from side to side. Okay, perfect. Her facial nerves is cranial nerve 7. So I want you to smile and then frown and then puff out your cheeks for me. Okay, good. Cranial nerve 8 is going to be her acoustic nerve, and since she was able to answer questions and she didn't ask me to repeat anything or what I was saying, I know that she can hear me, but we can also do the whisper test too. So what I'm going to do is I'm going to ask you to occlude that ear. I'm going to whisper in this ear and you tell me what word I'm saying, and then I'm going to do the opposite side, okay?
Pumpkin.
Good. I'll hold this side.
Ghost.
Okay, good. So that is cranial nerve 8. So for 9 and 10, it's the glossopharyngeal and vagus nerves. And we're going to check for her swallow reflex and her soft palate. We want to make sure that when she sticks out her tongue and says, the soft palate and the uvula rise together and that the uvula is lying midline. So I'm going to use tongue depressor for this. First, I want you to swallow. Okay, no difficulty with her swallowing. I want you to stick out your tongue. I want you to say ah.
Ah.
And I can see her soft palate rise. I can see her uvula in there is midline and it rises as well. Thank you. So for cranial nerve 11, that's her spinal accessory. So we're going to ask you to shrug your shoulders against resistance.
Okay.
So I'm going to put my hands here, and then I want you to raise your shoulders up. Okay, good. Now I want to check for your neck muscle strength. I want you to turn your face in towards my hand. Good. And then the opposite way. Good. Thank you. And then finally, we have cranial nerve 12, which is the hypoglossal nerve. And for that, I want you to just stick out your tongue. And it's lined midline. It's symmetrical. So we know that is intact. So that's all for the cranial nerves. Next, we're going to move on to motor function, and we're going to assess her coordination. When she came in and she sat in the room, I could notice that her gait was even and she has an appropriate stance. As she's sitting here, she displays good posture, so I know that is intact as well. I don't notice any involuntary tics or any gross deformities, and I don't see any muscle atrophy. We can do some passive range of motion on her large muscle groups just to check for muscle tone, to check to see if there's any rigidity or contractures, or if any of her muscles are flaccid. They're healthy, and I'm sure everything will be fine, but I'm just going to passively move your joints here. We're going to do some flexion and extension. We're going to do some abduction and adduction. We can do the same thing. We would do it on both sides, and we can do the same thing with our legs, extension and flexion, and even with your foot up and down. Okay. So moving on from there, we will do the skilled movements. So we're going to do muscle testing, the coordination and skilled movements, muscle testing for your major muscle groups. So for that, everything's going to be against resistance. I'm going to have her do all her motor skills against resistance. So I want you to spread your fingers out like this, and I'm going to actually hold them straight first. I want you to then, when I'm holding them, try and spread your fingers apart. Okay, good. Now, while they're apart, I'm going to squeeze them, and you try and keep them open, okay? Okay, good. Now I want you to make two fists like this, and I want you to, against my resistance, flex up and then flex down, okay? Up, okay, and down. All right, good. Now, while your arms are in this position, I want you to try and raise your forearms up. Good, and down. Good. And put your arms straight out. Again, try and raise them up and down. This is checking the strength in her shoulders. Okay, put it to your side, and I want you to raise your arm up this way. Good, and then down. Okay, perfect. We can do the same thing with her knees. So I'm going to push down on her leg, and I want you to try and extend your leg upward. Okay, now try and flex it down against resistance. Good. And we can do it with your ankles. You're going to lift the top of your foot up and then push down against my hand. Okay. We're also going to check her hips. So for that, I need you to lie back on the bed. I'm going to have you bend your knees. And then we're going to raise this up. We're going to bend it this way against the resistance of my hand, and then extend this way. Good. And we would do the same thing for both sides. Now you can put both knees and your feet flat on the bed. I want you to try and open your knees apart push against my hands. Okay, good. And now spread your knees apart and try and close them. Good. And then we're going to straighten this leg. We'll do the internal and external rotation of our hip. And we're going to fold it in this way and then push out this way. Okay, good. And again, that would be for both. Okay, you can sit up. All right, so from here we're going to do the, actually going to have you stand, and we're going to do the Romberg and prometer drift test. So for this, I'm going to have you put your arms right out in front of you, palms up. And then you're going to close your eyes, and while she's standing here, we're going to see how long she can, well, you would notice if someone is standing there with their eyes closed, if they would start to sway or lose their balance. And she's standing good, and then the last test we're going to do is we push down, and then her arms just reflexively bounce back up, so that's good. Okay, you can relax. So now we're going to just assess her gait, just rudimentally. We're just going to have her walk back and forth and make sure it's normal gait. Good. And then I just want you to do a little heel to toe walking in a straight line. Good. I want you to go one direction on your heels, and then the other way back on your toes. Good. And then if you could just do a shallow knee bend. Perfect. Okay, you can hop back up on the bed. All right, so now we're going to assess the rapid alternating movements. So what I want you to do is, I want you to put your palms on your thighs, and then I want you to lift them up, turn them, and use the back of your palms like that, and then lift and turn. And you're gonna do that as fast as you can, over and over and over, as fast as you can, faster, faster. Good, perfect. Okay, next is going to be the point-to-point test. So I want you to touch my fingertip with your fingertip, and then touch your nose, and I'm going to move it around, okay? Ready? And your nose. Good. Okay. We need you to do we're going to assess your heel to shin. So I want you to lay back again for me one more time, sorry. And for this part, I want you to use the heel of your foot, and you're going to drag it down the shin of your opposite leg down to your ankle. And you can do it with the opposite leg as well. Okay, perfect. You can sit back up again. So now I want to check your sensory nerves. So I want you to close your eyes. I'm going to use this Q-tip, and there's one end that's soft and one end that's sharp. And when I touch your face, I want you to tell me if it's soft or sharp, okay?
Soft. Hard. Hard.
Good.
Soft.
Okay, good. Now for the stereognosis test, I'm going to place an object in the palm of your hand. I want you to close your eyes, and you tell me what that object is, okay? You can hold out this hand, and just use this hand and try and feel what it is.
Bobby pin.
Good. Now give me the other hand. I'm going to put a different object in there. And you tell me what that is.
A key.
Correct. Thank you. All right, now I'm going to use your hand. I'm not going to write on you. I'm just going to pretend to write on you. Keep your eyes closed. And this is the graphesthesia test. I'm going to write a number on the palm of your hand, and you tell me what number I'm writing, okay? Tell me what it feels like.
8.
Perfect. For point localization test, I'm going to have you keep your eyes closed. I'm going to touch an area on your body, and then you can open your eyes and point to the area that I touched, okay? All right, you can just relax your arms. You don't have to do that. Good. Close your eyes again. Good. She got very close to it. And now we're going to use this bobby pin again, and we're going to do the 2-point discrimination test. So I want you to tell me when I touch your hand with the bobby pin, if I'm touching you with 2 points of the bobby pin or just 1 point. And hold out your hand. And close your eyes.
1. 2. 2.
Good. Now on the hand, you're more sensitive to it, and you can tell more easily. On the leg, it's a little harder. If the 2 points are too close together, it's a little bit harder to assess, but I'm going to try it on your leg. And you close your eyes, and you tell me if you feel 1 or 2.
1.
Okay, and that was actually 2 points. Keep your eyes closed.
1. 2.
Okay, very good. And then we're going to do the extinction test. So I want you to close your eyes, and when I touch you, I want you to tell me if I'm touching the left side of your body or the right side of your body, okay?
Okay.
Close your eyes.
Left. Right. Both.
Okay, good. Perfect. Finally, we're going to do, this part of the assessment, we would do reflexes. I do not have a reflex hammer, so I'm going to pretend with my pen. So we would first do deep tendon and then cutaneous reflexes. So for your deep tendon reflexes, I'm going to check your brachial radialis. So I want you to hold your arm out like this, and it's hard to see here. So like this, and I would find your brachial tendon here, and I would hit it with the hammer, and it would usually stimulate a reflex where her thumb and wrist would twitch this way. Then I would check her biceps tendon, and I would hammer here, which would also stimulate a twitch at the wrist. For her triceps, I would have her dangle her arm, shake it out this way, out this way, and I'm going to hit back here behind the elbow. It will cause a reflex to go this way. You can lower your arm. Then we would do the patella reflex. Across, there we go. We're going to find that little indent just below the top, her patella, and I would hit in that area, and that would stimulate her to kick her leg outward. The Achilles reflex is back here on the back of the heel. I would hit that, and it would cause her foot to reflex up. Okay, almost done. So I just need you to lay back one more time for me. So for the cutaneous reflexes, we're going to check her abdominal cutaneous reflex. So I'm going to again use my Q-tip, and I'm going to pull your shirt up. There you go. And I just want to see if I can stimulate her abdominal muscles to contract. When I do this, you can close your eyes. It's difficult to see. You probably can't see it, but I can see her abdominal muscles flinching and contracting when I do that. Sorry. While you're laying down, I'm going to check your Babinski's reflex and see if you can get me to the foot of the bed here. Okay. Bend your knee a little bit. So this is going to be on the bottom of her foot, and I would take a pen or the other surface of the hammer, and I would start at the heel of her foot, and I'm going to drag it up and across the ball, and that's exactly the response that is going to stimulate the plantar flexion. And that concludes our assessment of our neurological exam. Thank you.